Thank you for joining us in this new outreach to Medicare beneficiaries in Pennsylvania. A couple of things before we start. We expect this training to take about 30 minutes or so it is appropriate as an alternative presentation to the standard presentation you are used to delivering. Second, we will deliver this presentation as if we are speaking to beneficiaries. Third, although this webinar is being conducted using PowerPoint slides, we expect you will solely use the How to Read Your Medicare Summary Notice booklets during your presentations in the community. Finally, the transcript of this presentation will be made available to you, and we encourage you to personalize it to suit your presentation style. The purpose of this training is to teach older adults how to use their Medicare Summary Notice to track activity of their Medicare benefit. We hope that this will empower them to use the information in their Medicare Summary Notices in combination with other tools, such as the Personal Healthcare Journal, to detect fraud and abuse. We will now begin the training. Once again, please keep in mind that from now on, this presentation will be delivered as if we are conducting an outreach in the community. Welcome. In this training, you will learn about how to read a Medicare Summary Notice and how it can be used to detect errors and potential Medicare fraud. We will walk you through the purpose of a Medicare Summary Notice, the different sections included in each Medicare Summary Notice, how to detect potential errors or fraud, and how to use a Personal Healthcare Journal. We hope that this training helps you use your Medicare Summary Notice to better protect yourself against mistakes that could cost you and Medicare. In the interest of time, please hold on to your questions until the end of the presentation, as there will be time for questions and answers. So let us get into some general information about the Medicare Summary Notice. First, what is a Medicare Summary Notice? Basically, the Medicare Summary Notice is a document prepared by Medicare that records the medical services and supplies provided to you during a specific period of time, as well as a cost to Medicare and you for those services. When and how do you receive your Medicare Summary Notice? You will automatically begin receiving Medicare Summary Notices in the mail when you enroll in Medicare. Medicare beneficiaries who have original Medicare coverage, not a Medicare Advantage plan, will receive a Medicare Summary Notice every 3 months. However, keep in mind that if you received no services during a 3-month period, you will not receive a Medicare Summary Notice. If you receive both Medicare Part A and Part B, you will receive 2 separate Medicare Summary Notices in the mail for each period. I would now like to discuss the purpose of the Medicare Summary Notice. It is to document all your services or supplies that providers and suppliers billed to Medicare during a 3-month period. Also, it will indicate important information regarding your Medicare benefit, such as what Medicare paid for services you received and how much you may be billed for these services. It is important to remember that a Medicare Summary Notice is not a bill. If you are to be directly charged for a service, you will receive a separate bill in the mail. For those of you who are interested, you can elect to receive your Medicare Summary Notices electronically instead of in the mail. To do this, you will need to create a personal secure online account at www.mymedicare.gov, which is the official website for Medicare. Upon creating an account, you will be able to view your Medicare Summary Notice online monthly instead of every 3 months. In addition, you will receive an email alerting you that your Medicare Summary Notice is available for viewing. If you are interested in doing this, you will find instructions on how to receive electronic Medicare Summary Notices on page 15 of your booklet. So, Let's start walking through the different sections included in every Medicare summary notice. Please note that in this training, we will use a Medicare Part B summary notice. Also note that Medicare Part A notices follow the same format and have the same sections and section headings as the examples used here. There are 4 basic sections in each Medicare summary notice. Your dashboard, a section entitled Making the Most of Your Medicare, your claims, and a section on how to handle denied claims and file appeals. The first page of your Medicare summary notice will always be your dashboard. In the top left-hand corner of the page, you will see the official Department of Health and Human Services logo. Also indicated at the top of the page is the part of Medicare the notice covers. In this instance, this Medicare summary notice concerns Part B, or medical insurance. When looking through your dashboard, make sure your personal information is correct. Check your name, address, and the last 4 digits of your Medicare ID number. And then note the period of time that is covered in this Medicare summary notice. For example, in this case, this Medicare summary notice covers claims filed between June 15th and September 15th, 2011. Section 4 will give you a quick snapshot look at your deductible status. For example, here it states that you have met $85 of your $162 deductible for 2011 for your Part B deductible. Section 5 shows several important numbers. First, it will show you whether Medicare approved the services you received, and if not, will indicate the number of services that were denied. For example, here, it states that Medicare did not approve all the services, and actually 2 of the services were denied by Medicare. This section will also indicate the total amount of money you may be billed for. In this case, $150.86. Part 6 is a list of all providers who made claims on your Medicare account. Later in the notice, there will be more detailed information about your specific claims and how much money you may owe for each service you received. The final important part of the dashboard is information regarding language services found at the very bottom of the page. If you would like to receive help in a language other than English, call 1-800-MEDICARE and ask for an interpreter. The second page of your Medicare summary notice is entitled Making the Most of Your Medicare. The first box on the left-hand side offers some helpful tips on how to use your Medicare summary notice to prevent, detect, and report and protect yourself from mistakes and fraud. For example, it asks you to consider whether you recognize the names of the providers on your notice, as well as the dates of service. We will revisit these questions when we discuss how to keep a personal healthcare journal. The next section on this page gives you instructions for reporting suspected Medicare fraud, errors, or abuse that involve your account. This is a good place to take a few minutes and discuss what Medicare fraud is. Due to the complexity of the Medicare system, it is easy for innocent human errors to be made, such as duplicate claims, incorrect billing codes, or submitting a claim on the wrong Medicare account. However, sometimes these errors are not innocent mistakes and could be considered Medicare fraud or abuse. This can occur when a medical provider knowingly and intentionally misrepresents facts about these services or items to obtain payment. Fraud is different from human error or abuse because it involves criminal intent to receive inappropriate payment from Medicare. Some examples include billing for services or supplies that were not provided, prescribing unnecessary tests and services, or misrepresenting a diagnosis to justify payment. If you suspect that your account is involved in fraud, it is not your responsibility to determine if it is an innocent mistake, abuse, or fraud. This will be done by the authorities after you make a report. Now, not only does fraud financially impact you and the Medicare program, it can also negatively impact your health. For more information on this topic, please see the flyer entitled How Medicare Fraud Harms Your Health. This section, 3 and 4, gives you some resources to contact if you suspect fraud. For example, you can call 1-800-MEDICARE and speak to a representative. If your tip or tips help uncover a Medicare fraud scheme, you may qualify for a reward. It's helpful to have your Medicare summary notice in front of you during the call so you can report the exact discrepancy you noticed. You can also contact your provider as well as your state senior Medicare Patrol program. On the right side of this page, you can find reminders about preventative services and general messages. Medicare covers many important preventative services that are listed in your Medicare and You handbook. Finally, your general message includes reminders to get vaccines, for example here, your flu shot, or to watch your limit for services such as physical therapy, shown here. These messages get updated regularly, so please review them in each Medicare summary notice you receive. The third page of your Medicare summary notice focuses on the details of claims made on your account during the period specified on your dashboard. Remember that this page does not include any bills. In fact, no pages on the Medicare summary notice will include any bills. I must repeat that if you were to be billed for something, you will receive a separate bill in the mail. On the top half of this page, the notice will give you definitions of the columns used in the claim section. The claim section is in the bottom half of the page. Here you will see a list of all the services and supplies you received during this period. It should be organized by the date of the office visit or the date you ordered supplies. It will also list the provider's name and the location of the facility. For example, here, service was provided on June 18, 2011 by Dr. Jane Doe. This was physical therapy provided in Main Street, any town, any state. In the leftmost column, a detailed description of the service or supply you received will be listed along with a medical code in parentheses. So, in this claim, it is for therapeutic exercise to develop strength, endurance, range of motion, and flexibility. And the medical code or billing code is 97110. The second column will tell you if your claim was approved or denied by Medicare. In this case, it was. The third column will list the normal amount your provider charges for that particular service or supply. Column 4 indicates the maximum amount that the provider agreed to charge Medicare beneficiaries. Column 5 and 6 break down the number in column 4 into the 80% portion covered by Medicare and the 20% patient responsibility. So here, the fifth column lists the 80% of the Medicare approved amount in column 4, which in this case is $22.83. Now you will notice that column 6 looks a little different from the other ones. It's bolded and it's surrounded by a box. This represents the maximum amount you may be billed for the service. It should be the difference between columns 4 and columns 5. This amount may be covered by a supplemental plan, such as Medigap, or you may have to pay it out of pocket. If you are responsible for paying this amount, you'll receive a separate bill in the mail. Lastly, there may be a letter next to your claims. These letters refer to notes found at the very bottom of the page and will provide you with additional details about the individual claim. For example, in this claim, The note states that the claim was sent to the beneficiary's Medigap insurance policy. Other potential messages may be reasons regarding why a claim was denied. This third page of your Medicare summary notice is very important because it will help you in detecting mistakes or fraud on your Medicare account. You should call Medicare to report suspected fraud if you do not recognize the provider's name, did not have an appointment on the date listed, did not receive a service or supply described, or if there are repeated claims for the same service. These are signs of potential fraud, or they may just be simple mistakes that can be corrected once you report it to Medicare. You can also call the Pennsylvania Senior Medicare Patrol for help. Counselors can assist you in calling the provider to see if an error was made. Counselors can also help refer cases for investigation. The last page of your Medicare summary notice is a page dedicated to helping you handle denied claims and file appeals to Medicare. If you think something is wrong in your claims section, first contact your provider, either the doctor, the hospital, or the supplier, to check if it was a mistake on their part. It may be helpful to ask your provider for an itemized statement for the claim. If it was not a provider's mistake and you think you have been overcharged, you can file an appeal in writing by using the form on the right side of the page. The written appeal must be received by Medicare before the date listed on the page. Generally, you have 120 days to file your appeal from the date you get this notice. In this case, it indicates that an appeal must be received by January 14th, 2011. If you would like assistance filing your claim, call Medicare or your local Apprise program. If you need help finding your local program, call CARIE or your local area agency on aging. The number for contacting your local Apprise office can be found on the Need Help, Get Help flyer provided in this presentation. Finally, this section gives you instructions on filing an appeal along with who to send the appeal to. Again, if you need help with this, contact your local Apprise office or CARIE. You can also ask a trusted friend or family member to assist you. Now that we've walked through each section of the Medicare summary notice, let's talk about how to keep a personal health care journal. For your convenience, we have provided you with instructions on keeping the journal, as well as a journal on pages 12 and 13 of your How to Read Your Medicare Summary Notice booklet. In addition, feel free to take a personal health care journal handout. It's very similar to keeping a checkbook for tracking your spending. However, instead of tracking the checks you wrote, a personal health care journal helps you track the services and supplies you received that should appear in your Medicare Summary Notice or explanation of benefits. It's easy to keep a journal, and it can be very helpful for avoiding mistakes, abuse, or fraud on your Medicare account. The basic idea is to record the information for each service or medical supply you receive. Every time you receive a service, record the date of the service, the name of the provider, and the type of service or supply received. This information should be recorded in the first 3 columns of the page. Then, when you receive your Medicare Summary Notice in the mail, you can compare the information in the notice to what you have recorded in your journal. Some important things you want to be on the lookout for are charges for services that you did not receive, duplicate charges, or services that were ordered by a provider you don't know. You should be able to identify these discrepancies by comparing your Medicare Summary Notice and what you recorded in your personal health care journal. If you notice any of these mistakes, contact the provider to report the discrepancy. If that does not work, call the Pennsylvania Senior Medicare Patrol or Apprise or Medicare for free confidential help. Let's wrap up by talking about some other simple ways to protect yourself from fraud. First, if you receive benefits from other insurance plans, such as Medicare Advantage, you should regularly receive explanation of benefit notices, or EOBs, in the mail after you receive services or supplies. Checking these documents are just as important as checking your Medicare Part A or Part B notices. EOB notices will look different from the Medicare summary notices we just reviewed, but they include most of the same information, and they are very important to compare to your personal healthcare journal. They contain important information relevant to your specific policy and how you can get help if you see a mistake or potential fraud. If you would like help reviewing your explanation of benefit documents, please call your local apprised programs or the Senior Medicare Patrol if you suspect fraud. Here we would like to cover the steps to take if you spot an error in your Medicare summary notice or EOB. First, call Medicare, and if comfortable, the provider listed along with the service in question. We also encourage you to contact the Senior Medicare Patrol, and we would be happy to assist you in resolving your concern. Here are some last pieces of advice from the Pennsylvania Senior Medicare Patrol to protect your Medicare benefit and protect yourself from fraud. First of all, protect your Medicare ID number or Medicaid number as if it were a credit card, and never give any personal information, such as your Medicare account number, to callers or people who show up at your door. Medicare and Social Security will never call you to ask for personal information. They already have it. If someone asks you for information, it's probably a scam, and you should hang up and report them to Medicare. Finally, always ask, always rely on your personal doctor to recommend all medical services and supplies. So, remember, your Medicare summary notice, or EOB, in combination with other strategies, is the most important tool in detecting errors and potential fraud in your Medicare account. Also, please do not hesitate to contact your Senior Medicare Patrol at 1-800-356-3606 for free and confidential help if you suspect errors or fraud in your Medicare account. This now concludes our presentation for today. We thank you for your time and attention.